Welcome to this presentation. In the earlier weeks, we have observed many actions and functions, role and responsibilities of mainstream media and communication system for individual members as well as for the social and country level institutions. Primarily, the mainstream media focuses or functions related to information, education and entertainment. As a normal individual user, our interaction with mainstream media revolves around collecting information or trying to enrich our knowledge through educational role, or we spend time with television or other medium to entertain ourselves. These are the primary functions of mainstream media, but otherwise as an individual we used to interact with many members within the family, within the society or in the official context. Our communication process deals with wide variety of information, wide variety of context, wide variety of communication settings. But the media and communication system can play an active and productive role in the society as well as for the individuals, beyond the information, education and entertainment. One of the crucial area is health. The wealth of the nation or the quality of the society are determined by many factors. One of the very valuable factor is the healthy conditions of the society and the healthy conditions of individual members. Unlike a political news, unlike a sports news, which are framed or written in a very structured way and not much on planning a strategy is being inbuilt in the news stories. Whenever the news conference happens or event happens or any interview or profile, writing a profile, they'll inform the audience about the event or they'll try to interpret the event. When it comes to the health part, this is a very crucial matter. Even something wrong in interpretation may create havoc. This is a mainly part with communicating the health information to the wide audience. But even otherwise also, many departments, health departments of the government or public institutions or many civil society agencies or non-governmental agencies or volunteers or community health workers, they'll try to use multiple communication tools to reach the wider audience, because the health resources, health structure, health infrastructure are limited and that can't cater to the wide number of people, and sudden growth or sudden pandemic kind of situation means our health infrastructure may not cope up with the inflow of patients. The main part of the communication strategy is to control the disease spread and preventing the pandemic kind of situation, preventing the disease spread. And particularly in order to make that point, the health communication plays a role in changing the behavioral patterns of individual or group members. The news stories of the common characteristics like politics or health, or politics or sports or business, they are not meant to change the behavior, but meant to change the opinion, meant to change or add a knowledge system to the individual member or the collective audience system. But the health communication part, either through mainstream media or through interpersonal or through any other communication system, primarily deals with changing the behavior, having a personal hygiene and protecting ourselves when dealing with multiple scenarios, or using the helmets, accepting vaccination or discarding the smoking behavior. So it may not happen overnight. Changing the behavior is a very long drawn strategy. Multiple factors plays a role. The family should accept that, or the parents should accept that, or individual herself or himself should ready to change, ready to accept the behavioral change, either to accept the new health information for sake of betterment of the health or avoiding certain behavior for the betterment of the health. Both the level, positive and negative level, it's a kind of changing the behavior. That's a very crucial part, and health communication has to be sustained in a multi-pronged manner using multiple communication tools along with all the other agencies and proper policy directions. These are the broad areas of the health communication, and this presentation we are talking about not only the individuals, as we are talking about the society's health conditions. So that's why the title of the presentation we made it like that: public health communication, taking care of the society and the individuals. There are three segments in this presentation. We will try to trace out what are the background information about the health communication, what are the main functions of the health communication, and what are the methods being used for health communication to reach out the wider audience or individual members. So these are the three focus area of this presentation. Before going to the public health, let us understand little bit about communication. Communication refers to the transmission or exchange of information, but that doesn't end in the transmission itself, doesn't end in exchange of information itself. There are multiple stages involved beyond information reaching the individual or reaching the collective members. The main purpose of communication in any settings basically to initiate the actions in the receiving end and make sure that the communication and communication system understands what are the needs and requirements of the audience segment. Accordingly, the strategy can be planned. If the strategy is planned in such a way that it provokes or creates certain actions. So in order to initiate the actions of the first line, the communication strategies need to know the needs and requirements of the audience. The third important point in the communication in any settings is exchange of information, ideas, attitudes and beliefs. It's not just information is being exchanged between A and B. There are a lot of ideas and attitudes and belief systems are being exchanged. That needs to be reciprocated. That needs to be decoded properly. That needs to be accepted by the vast majority of the audience system. If the acceptance rate is higher, then there is a higher chances of behavioral change. If there is a higher chance of behavioral change, there is a possibility of controlling a particular disease or pattern of health disorder in a particular geographical area or in a vast boundary of the country. Beyond the exchanging the attitude and beliefs, the fourth stage is it's creating kind of mutual understanding. What the communication information is providing and how audience are understanding. If this is matching equally, then there is a success in exchange of attitudes and beliefs. And also it's not a one day affair or one time affair. It has to be sustained in a longer enough. The media system or communication system needs to establish or maintain a relationship with the audience segment. So these are the main broad areas of communication, particularly within the context of health communication. So in this broad functions or role of communication settings in the health part, communication plays an integral role in the delivery of healthcare and promotion of health. According to Healthy People 2010 guideline, health communication can be defined as it's a system, it's a process, contains the use of multiple communication strategies to inform and influence individual and community to take a decision in order to enhance their health. It's health communication linking the two different domains, communication and health. Beyond that, the health communication focuses on influencing the individuals and influencing the community to take action, to take a decision in order to enhance their healthy conditions. The communication content has to be strong enough, and that motivates the individuals and group of people and the ability to influence them to change the behavior. That's the broad definition of health communication part. Health communication uses multiple strategies, but multiple strategies to inform and influence the individuals and community. That's, we understood that. But primarily this kind of process of informing and influencing the people deals with the three primary areas. The information and the communication in order to influence their knowledge, influence their attitude, influence their practices. In short, they call it as a KAP. And the KAP is very crucial with regard to health and health care. Influence is be successful in terms of changing their knowledge, changing their attitude, changing their practices. If you look at all the three words, knowledge, attitude and practice, leads to the behavioral change, provided audience or the recipient of the communication accept the information, accept the messages in order to improve their health and healthy conditions. The communication, health communication represents the interface between communication and the health, and is being become very vital, and it getting recognized as a necessary element for improving both personal and public health. In the COVID-19 situation or in the pandemic situation across the countries, across the global conditions, you can understand very easily the role of communication, the role of influencing factor of communication to change the behavior, using the social distancing, using the masks, using the sanitizer. These are the changes in your lifestyle. We're changing the behavior. If that leads to the control of the disease spread, remember that. We are not just in the COVID-19 situation, we are not informing the audience, the mass people, you take the precautions, or you do this, do and don'ts. We are not doing only the informing the people. We are trying to influence them to change the behavior, to adopt social distancing, using the mask, using the sanitizer. So that's a very crucial part of health communication in order to maintain and control the spread of the diseases. And health communication can contribute in this context all the aspects of disease prevention and health promotion. Through the public health communication pattern or strategies, there are a particular level of domains, a particular level of goals are achieved. These are the functions of public health communication. Virtually every one of us might have exposed to health messages in various stages, maybe from the television, maybe from the newspapers, or maybe from the billboards, or personal short messages, SMSs or WhatsApp messages, or from our own friends or official settings or in the family context. Health communication, health messages spread like a wildfire in certain context. Okay. And many times our health messages spread or disseminated through public education campaigns. That the campaigns seeks to change the social climate in order to encourage healthy behaviors, create awareness, change attitudes, and motivate individuals to adapt recommended behaviors. The behavioral change is a crucial outcome of health communication that's being repeated frequently in many literature. The communication strategy has to aim in that direction, not just in informing, it has to influence the people. The campaigns, communication campaigns related to the health factors traditionally have relied on mass communication and multiple levels of educational messages in a printed materials to deliver the health messages. Electronic media played a very crucial role, and equally the printed material also playing a role. The reason, the difference is the electronic media, particularly radio and television, doesn't require a kind of minimal literacy capability. For the printed material, someone has to be familiar with the language, and the reach also limited with the printed material, whereas the radio and television can reach the wider audience. And there are these two or not necessarily the three important media elements, but these media elements like electronic media and print material has to be integrated with community based programs, has to be integrated with the social marketing techniques. There are three primary methods are being used while doing public health campaigns. One is individual approach, second is a group approach, third is a mass approach. Because the health communication doesn't rely on one particular approach, it has to be integrated with the multiple segments, multiple approaches in order to reach a wider audience. Sometimes reaching the individuals, the personal level, or reaching the group level, or using the radio and television to reach the entire society. So these three approaches are quite common in any public health settings. We will take up the matter of each approaches individually. The individual method is basically deals with intrapersonal communication. Intrapersonal communication, if you are familiar with the communication settings, you can understand that if it is the interpersonal communication, interpersonal means between two persons, two or more people at the small numbers. Intra means the communication happens internally, because compared to other communication messages, health communication primarily meant to influence your knowledge and your attitude and your practices. So when the health message reaches a particular individual, there are a lot of chain reaction happens within the particular person. This whole process of accepting or rejecting, analyzing and approaching that information, multiple perspectives of own experiences, or sometimes age, sometimes education, economic conditions, cultural background, family conditions, many factors plays a role while processing health communication, health information, health messages. So the whole process we can classify as a process happens within the person, within one single person. So that's a example of this individual method. Intrapersonal communication takes place within the single person. It is usually considered that there are three aspects of interpersonal communication while dealing with the health information, either in accepting the message or neglecting the messages. One is a self-awareness, second is a perception, third is expectation. In the self-awareness level is a part of the intrapersonal communication that determines how a person sees him or herself, how they are oriented towards others. Self-awareness includes three factors: belief, value and attitudes. The awareness, the information has to supplement, strengthen or change the beliefs and values, attitude of the person. If there is a substantial change in these three aspects of awareness level, beliefs, values and attitudes, then the awareness level of the person goes little higher in response to the message received, either in the positive way or negative way. Second aspect of intrapersonal communication is perception. Perception is about creating an understanding of both oneself and one's own environment. And perception is being aware that one's perceptions of the outside world are also rooted in beliefs and values and attitudes. The intrapersonal communication is not happening in a vacuum. Basically, the intrapersonal communication deals with the beliefs and values and attitudes, but the beliefs and values and attitudes is not a standalone process within a person. All the three are highly influenced by the surroundings, family structure and the educational settings, the age, the multiple factors of external world influences one person's beliefs, values and attitudes. The success of the health communication is based on the person's perception from the perspective of the beliefs, values and attitudes. The third aspect of intrapersonal communication is expectations. Expectations are future oriented messages dealing with the long term roles, sometimes called life scripts, and it fulfills somebody's needs, somebody's expectations. Intrapersonal communication is used for clarifying ideas or analyzing a situation, also reflecting or appreciating something. The outcome, the positive or negative, all depends upon a person's beliefs and values and attitudes under the three primary segments of three factors of intrapersonal communication: self awareness, perception, expectations. The second level is group method. Interpersonal communication is another dimension of the communication pattern. Intrapersonal, we are seeing in the individual level. The group level, it's an interpersonal communication. Interpersonal communication is the interaction between two or more people or groups. Health professionals are using this kind of communication form, interpersonal communication form of communication all the time during their health work. Particularly the community health work uses extensively of the interpersonal communication to influence the individual. This form of communication can be face-to-face, two-way, verbal, non-verbal interaction, and includes the sharing of information and feelings between individuals and groups. The most important parts of interpersonal communication are characterized by strong feedback component. Unlike the mainstream media, where we can't interact with the person who is speaking to us, in interpersonal communication, either 3 people or 5 people gathering, in the street corner, talking about the impact of the particular health messages, the audience or the member of the group communication can interact with the community health worker instantaneously. The doubts can be clarified, further information can be obtained. A constant feedback component is guaranteed in the interpersonal communication. That's one of the added advantages of group communication method. Interpersonal communication involves not only the words, it's not a verbal communication, but also various elements of non-verbal communication. The purposes of interpersonal communication are to influence, help and discover, and as well as to share and perhaps even play together. The group method, there are main benefits of interpersonal communication includes transfer of knowledge and assisting changes in attitudes and behavior. It will also be used to teach new skills such as problem solving. Communication takes place in both directions, from the source to the receiver or vice versa. There is a chance to raise a questions, to start a discussion so that the idea is understood by both the parties. Since the communication is interactive, there is a high chances of utilizing more than 2 senses such as seeing, hearing and touching that. Adoption of behavior pattern passes through the several stages. Interpersonal communication has an importance in all these stages. It's related to help someone to change their health behavior. If the health professional wants to influence a small group of people, then they have to rely heavily on interpersonal communication. Particularly, it will be very, very important, very influential when the health topic is a sensitive matter, or it's being considered as a taboo in any social settings. The third method in public health communication is mass method. Mass communication is a means of transferring messages to a large segment of the population. Electronic and print media are commonly used for health communication extensively. Remember that the importance of local folk media such as local art, song, plays and puppets also playing a role in a different context. The powerful advantage of mass media over the face-to-face communication system is it can spread the message in the simplest way to the wider audience, to larger population at the lowest cost and with a limited time. The main effects of mass communication are the increased knowledge or increased awareness of an issue. Potentially, it can influence the individual behavior at the early stages, and the possibility of communication to change the ideas and influence the early adopter, particularly opinion leaders like a teacher, a postman, or the local political leader. They can influence the other members of the society. The mass media communication offers a kind of accuracy and credibility of the information comes from the health professionals. That a lot of credibility can be attached with the mass communication process. So these are the 3 methods, individual, group and mass communication methods being used for public health communication. We have seen the functions, we have seen the definitions, we have seen the methods in the presentation. In the next presentation, we will see the components and strategies of public health communication along with the barriers of health communication. Thank you.